That false sense of safety from the virus is being seen in some of the most crowded locations in Kigali City, like in its taxi parks, markets and on the streets, with people clearly not putting in as much effort to uphold safety measures and sometimes downright ignoring them. Based on the figures they are giving us, with no new cases in Kigali, with preventive efforts continuing, it looks like the pandemic is receding. I hear the pandemic is in Rusizi. Here we have been washing our hands and practicing social distancing. We have been very careful in Kigali. There is no pandemic here. People are not dealing with this problem collectively, with some not even properly wearing their face masks. If we are to beat this, we must work together and listen to the directives issued by the government. Even when people implement the safety measures to prevent the spread of the virus, they do it just to prevent getting punished for not doing so, instead of understanding just how important it is. They do it just to avoid problems with the police and the youth volunteers. We have been able to mitigate its spread by washing regularly and other measures like social distancing, working in shifts, leaving a meter between us, as you can see here and here. Health officials are warning against such attitudes towards the pandemic, however.
Rusizi na Rusumo cyangwa na Kirehe ni uturere twibasiwe cyane.
Rusizi, Rusumo and Kirehe are the most affected towns and districts, but that does not mean that other locations have not been found with cases either. We have found isolated cases, and even in Kigali City we recently found cases 5 days ago. The fact is, the role of the general public in fighting this pandemic is by far the most important, even more than the task force engaged in it. Cases have certainly been found in Kigali following the lifting of the total lockdown. Another location affected is Nyamasheke district that is close to Rusizi. Travel between the two is very easy. A case was traced of a driver who worked in Rusizi but lived in Nyamasheke, and I must commend the team there for making the connection quickly. Complacency has become evident, with people thinking that the pandemic is far away from Kigali, while the coronavirus could be closer to you than you think. Realizing that is key. Since the first case of COVID-19 was identified in Rwanda back in mid-March, close to 600 people have since contracted it, with almost 300 still active. The rise in the number of infections has largely been attributed to cross-border trade.